Hi everyone. Today we are going to learn about National Nutrition Policy. I am Dr. Bula Dallas, HOD of Community Health Nursing Department, Triple M College of Nursing. Nutrition is a fundamental determinant of health, growth of the children, and the development. In India, malnutrition, especially among children, women, and vulnerable groups, has been a major public health concern. To address this issue comprehensively, the Government of India formulated the National Nutritional Policy in the year of 1993. Why we need this nutritional policy? We have high prevalence of protein energy malnutrition in India, widespread of micronutrient deficiency like iron deficiency, vitamin A deficiency, iodine deficiency disorders, poor maternal and child health indicators, poverty, food insecurity, and lack of awareness, inadequate healthcare and sanitation in India. What is the main aim of this nutritional policy? To improve the nutritional status of the population and ensure optimal growth, health, and productivity among the vulnerable group. The goal of this policy, we have overall goal and specific goal. Overall goal of this policy is to improve the nutritional status of the entire population, especially vulnerable groups, and achieve optimal health, growth, and productivity. Let's see about the specific goals. The first goal is reduction of malnutrition, that is reduce protein energy malnutrition among children, decreases levels of underweight, stunting, and wasting. The fourth goal is food security for all, ensure availability, accessibility, and the affordability of food, and helps to strengthen the public distribution system of nutrients. And the fifth goal is protection of vulnerable groups, mainly focus on infants and young children, especially up to 5 years, pregnant and lactating women, adolescent, mainly focus on girls, low-income populations. The next goal, reduction of morbidity and mortality. As we all know, this morbidity that is related to disease and mortality is related to death. So lower infant mortality rate and the maternal mortality rate prevent nutrition related diseases among all the vulnerable groups. The seventh goal is nutrition, education, and awareness. So awareness is very important to prevent all the nutrition diseases among the vulnerable group. So by this awareness program, we can promote healthy eating habits, improve the knowledge about breastfeeding, complementary feeding, that is weaning food after 6 months, till 6 months exclusively for breastfeeding to be given, and hygiene and sanitation. And the eighth goal is intersectoral coordination. Integrate efforts of health sector along with agriculture, education, and women and child development. The next one is poverty alleviation. Let us address the root cause for malnutrition through the employment generation as well as economic development. So here the malnutrition is mainly related to poverty. That's the reason we have to empower the people at the same by giving employment. Through that we can improve their economical status. The 10th goal is monitoring and surveillance. So establish system for growth monitoring, especially for 5 years under 5-year children, nutrition surveillance for all the vulnerable groups, and all the national programs related to nutritional related program can be evaluated continuously. So main objectives of this national nutrition policies, here we have short-term objectives and long-term objectives. The short-term objectives are improve nutrition among vulnerable groups, mainly children, pregnant women, and lactating mother. Control and prevent micronutrient deficiency. Strengthen the nutrition supplementation programs. The long-term objectives are ensure food security, improve dietary patterns, reduce poverty and inequality, promote nutritional education and awareness. The strategies using by this national nutrition policies or can be it is two type of strategies are there, that is direct strategies and indirect strategies. The direct strategies, otherwise called short-term strategies or short-term interventions, these focus on immediate nutritional support like supplementary feeding program, growth monitoring, nutritional education, micronutrient supplementation like iron and vitamin A, iodine supplementation, fortification of like iodine salt, and the indirect, that is long-term interventions. These address underlying the process of food security through agriculture and public distribution system, poverty alleviation programs, improve healthcare services, safe drinking water and sanitation, also women empowerment and education. The major components of this policies were food supplementation, nutrition education, micronutrient deficiency control, food fortification, monitoring and surveillance. Some of the programs which is included with this national nutrition policy, they are integrated child development services. In shortly we can call it as ICDS or Anganwadi program, midday meal schemes, national iron plus initiatives, vitamin A prophylaxis program, national iodine deficiency disorders control program. Achievements: reduction in severe malnutrition rates, improved awareness about nutrition, expansion of ICDS and school feeding programs. Nowadays, including they are providing breakfast for the children, and they are having the upcoming plans up to, they are extending this program up to 8th standard students. Progress in iodized salt usage, reduction in vitamin A deficiency cases. The challenges of these policies were persistent malnutrition and stunting, regional disparities, poverty and food insecurity, lack of proper implementation, and poor awareness in rural areas. What is the role of nurse? Here, she can conduct nutritional assessment and growth monitoring, provide nutritional education to the families, promote breastfeeding and complementary feeding, identify and manage malnutrition cases, implement national nutrition programs. Also, community awareness and the counseling can be conducted by the nurse. Monitoring and evaluation is very important. Continuous monitoring, evaluation is very important. Here, how can we do the evaluation? By doing regular surveys and growth charts, health records, program supervision at the different levels. Some latest updates on national nutrition policies were: first one is shift to mission-based approach. The old policy is now strengthened through nutritional missions and schemes. The major transformations are national nutrition policy, that is 1993. Now it is changed into Poshan Abhiyan from 2018. And the latest program, it is renamed as Mission Poshan 2.0. These programs aim to create a Suposhit Bharat, that is well-nourished India. The main motto is eradicate anemia, stunting and malnutrition. Let's summarize the topic. The National Nutrition Policy, which was introduced 1993, is a comprehensive approach to combat malnutrition through both direct and indirect intervention. It emphasizes improving food security, healthcare and awareness to enhance the nutritional status of the population. Let me conclude this topic. The National Nutrition Policy plays a crucial role in improving public health in India. Despite significant progress, continuous efforts, effective implementation and community participation are essential to eliminate malnutrition and achieve better health outcomes. Thank you for your patience listening.